you're checking the breast yourself to see if there is any anomaly. Then we have mammogram. Those are done in the hospital, biopsy, breast MRI, and the likes. Then the treatment for breast cancer, basically we have three treatments. I will not bore you with that. I will just mention them and we'll move on. Chemotherapy, we'll use radiation, then surgery. It is either for people that the cancer, if that person goes to the hospital early enough, a lumpectomy will be done. That is removing that lump alone. But by the time it has spread, mastectomy, they will remove the entire breast completely. Some patients will choose to also remove the second breast. It depends on the person. You can choose to remove the second breast. You can choose to use an implant on the affected breast after the surgery. So there is hope for anyone who has breast cancer. How can we prevent this breast cancer? One of the ways that we can prevent breast cancer is what we are doing today, creating awareness. It is the most important thing. A lot of people will still tell you, I don't know what breast cancer is. But if you and I make it a point of duty, as you are hearing it today now, wherever you go to, Sister Tola, this is the sign and symptom. This is how we are supposed to do it. You know, we are already creating awareness, thereby reducing the mortality rate caused by breast cancer. Number 2, for the prevention, regular medical checkup. If we go to the hospital often, anything odd in your body, this will help us to prevent breast cancer. Because by the time you go to the hospital, you do a breast examination. They could tell you a breast ultrasound is just like when you go for a scan during pregnancy. But it's just that that thing they use to touch the abdomen is different from the one they use for pregnancy. But it's the same machine. So when you go for medical checkups, we can easily check if there is any anomaly. Then mammography too can also be done. Like I mentioned earlier, for the risk factor, I mentioned obesity. So if you are obese, keep your weight in check. Reduce your weight. Reduce your weight. Be physically active. That is exercise. Eat lots of fruits and vegetables. Stop smoking. Like we said, whether you are an active smoker or a passive smoker, stop smoking. Don't stay near people that are smoking. Avoid them as much as possible. Then the last one that I'm about to mention, I'm being careful about mentioning it because I don't want it to create a controversy. It's about oral contraceptives. What happens to majorly hormonal methods? They don't cause breast cancer. They don't cause cancer. What they only do, if a person has cancer already, and you are now on hormonal method of family planning, maybe pills and all of that, it will aid the multiplication of the cells. They don't cause cancer. Family planning doesn't cause cancer. Pills doesn't cause cancer. But once a patient has cancer, once you come down with cancer, you must stop that family planning because it will aid, it will promote cancer in the body. So, one of our prevention, we said we should go for regular checkup. But thankfully, we have something we can do even in the confines of our houses that will help us prevent this breast cancer. I mentioned it earlier, breast self-examination. How do we perform a breast self-examination? I will explain it in simple terms so that we can understand and always do it at home. You remove your clothes, whether shirt or top, anything, remove the shirt. You can either sit down or stand up in front of a mirror. Do it, you will not know. So by the time you stand in front of a mirror, you know you can't be looking at your chest like this. The mirror will help you see whatever is on the breast. You look at the color, the shape, the contour. When I'm talking about the contour, this part, this lower part, you can lift up the breast to check the contour. The shape of the nipple, is it pointed? Is it inverted? Inverted means that instead of the nipple to be pointed, It will be inward. That's what inverted means. So the color, the shape, the size, the texture, those are the things you look out for while you are checking the mirror. You know, your hands will be by your side while you are looking. That is looking. Your hands will be by your side. By the time you are feeling, your hand will be at the back of your head, this way. Looking, your hands by your side. So for examine the left breast, your left hand will be behind your head. For this one, for this feeling, you don't need to stand in front of the mirror. But for looking, you must stand in front of the mirror. You can either lie on the bed, you do it standing. So by the time you're examining the left. So while we're examining the left breast, you use your 3 fingers. These 3 fingers, those are the fingers we use for examination. You place the finger wherever you are about to start the examination. You start the examination farther. Start the examination farther from the nipple. Do you understand? And firm.